important component of One Health, and I'm here to stress and argue that this is a missing link for building the resilience of One Health and public health, especially for global security. Where there's a very well connection between the veterinary research and the global security. So these are the different systems, human health, animal health, environmental health, public health initiatives, and then cross-sectoral collaboration. If we see this, veterinary research is the nucleus of the entire operation. For example, if you take human health, that now we know that almost 75% of the diseases originate from animals. So naturally, the veterinary research is important. If you take environmental health, a lot of antibiotics are used in animals and other plants, and end up in this so-called antimicrobial resistance to all, and again through food animals, it goes back to the human. And of course, cross-sectoral collaboration is very critical, especially in countries like India, where we have a lot of people working in silos, both in the government as well as in academics and elsewhere. And how veterinary research part of this unified health. Most of the diseases in animals are transmitted zoonosis, like 75%. And it's not just that. See, many of these diseases has to be controlled by the veterinarian, but the disease originates at the animal. So unless it is taken care, the well-being of animal health is taken care, it's going to jeopardize the human health. So that is very critical. And it includes even our previous speakers are talking about rabies. Unless you prevent the rabies in the dog, you cannot ensure that human is free from rabies time. So that forms a very critical component of unified health. And especially the veterinary research acts as a bridge between the human health and even the planetary health, I would say. Because planetary health again involves environment, animals and human. And veterinary research is a very critical component. And if you see this small diagram where we start with, there is a small problem in animal. There is some disease in animal. So if the animal health is not taken care, the pathogens will amplify in the animal and naturally end up in AMR and other environmental contamination. And you all heard about avian influenza, that it causes scare among human. And nowadays even the avian influenza virus is jumping course. So the veterinarian's role is more critical, especially in zoonotic viral pathogens. See, COVID is just one, and we have a lot of viral pathogens ready for the next pandemics. And rabies is another area which is time immemorial. Rabies is there for years, but the problem is now again that human behavior and how we are respecting the environment. When we do not keep the environment safe, these especially rabies control become very challenging and difficult. And there again, veterinary research is very critical. And even there is a disease called rinderpest, which is a viral pathogen. This was controlled by world level. So veterinary research definitely can bring about many global solutions. And so this necessitates promoting collaboration. See, we have Indian Council of Medical Research or Indian Council of Agriculture Research, but many of these organizations work even now in silos. For example, many of the research projects are being carried out concurrently in the Medical Council and their institutes and also Agriculture Institute. But there will be a missing component where they can put together, and of course now the entire world and many international organizations, including Government of India, is trying to push the One Health collaboration. And in fact, we organized an AMR program in Hyderabad University. We came to know there are about 26 participants, and we were shocked to see even in city of Hyderabad where we had collaborators from the veterinary, medical, environment and biotechnology. People have a lot of for example, antimicrobial status, somebody has it in environment, somebody has it in animal, somebody has it in a hospital setting, but there is no connecting point. So there, like what happened, that many of these, etiologies now originate to animal, and naturally veterinarian's role is very important. And for that only now the government of India is trying to give joint training program for veterinarians and medical under even the World Bank funded program, as well as there are many calls now for One Health professionals, and in fact we are now trying to create a collaboration in Hyderabad and Telangana to start with. We are creating a One Health conclave wherein we are bringing in collaborators from the different state, from the different disciplines, and such efforts are needed worldwide, and veterinarians can be the nucleus. And of course, transdisciplinary research is one which is still lacking in India. People think that they are good at their studies and they do not want to reveal. So this, when people leave the research doing in silos, then comes the real solution. And this is example, this is a real example that in a small part of the country where they have done oral swab in both in animals and in fixed geographical area. They normally they take the normal microbiome, the gut microbiome, oral microbiome of animals and human, and they also found to the antimicrobial reduction, antimicrobial resistance reduction is almost same in both the species. So what happened? We think that our food habits and our digestive system is different than of animal. But what happened? Ultimately, the antimicrobial resistance found to be very common. So this is just a small study. Oral swab collected from both from animal and human indicated some of these pathogens which are commonly resistant in both the species. So this is just an example, and there are many more examples. And of course, many of these, Government of India organization or many of these new agencies which are created for One Health does not have a multi-sectoral component, stakeholder. The problem with, like people think that if we reveal the data to others, that they may not, they are assured their data is insecure. So they don't provide the data to others. So that kind of, attitude should change so that we are able to arrive at a single solution for the entire thing. And like most of these infections in animals, we don't see. This is underrepresented. So we know few of the viral and bacterial pathogens, but there are many pathogens in animals which are definitely, threat to human being. So unless we work on it by doing veterinary research, we are unable to assure the health of the entire planet, not just human. And so there are many instances where like bioterrorism. You might not have heard much about bioterrorism, but countries like US, they worry about that. So what happens is many of the pathogens, especially the animal pathogen like anthrax, are used as a bioterrorism. So, but these there are a lot of, even when we were in Tanuvas, I was working in Tanuvas, we had a small collaboration with some of the organizations in US. So that this will definitely help us in preventing any misuse of these pathogens as a bioterrorism. So these definitely involves the role of the veterinarian and the veterinary research. See, this basis anthrax is just one, many such bacteria and virus. And also epidemic preparedness. In fact, epidemic preparedness is very important, especially for diseases, viral zoonosis like avian influenza. So unless you have some kind of early detection, unless you detect it even very early in birds, say for example, as Dr. Nanamal was telling, there are some cat is infected, some birds are infected in one corner of a country. That doesn't mean that this is going to be a localized infection. It could flare up anytime, nationally and even internationally, because virus does not respect borders. And toxicology monitoring is well. I think we had a presentation where she was telling hedgehogs were a sentinel animal for toxicology. This is just an example. We were even studying several parasites wherein some of the animals act as sentinels. So the more and more research on veterinary is very critical, especially for One Health and planetary health. Of course, transboundary movement I will not tell, because this transboundary was now with people with a lot of disposable money. We have a lot of migration, not just human, but animals as well as animal product. So these transboundary movement will definitely be another factor which has to be taken care for a safe thing. And of course, there are a lot of veterinary and public health integration challenges are there. And like especially the joint programs, many of the programs does not involve all the multi-stakeholders. And there should be center for excellence, wherein of course the government of India, Nidhi was telling that government of India has some One Health program or One Health camp or One Health clinic, and even they conducted a kind of program in Rajasthan where they created a scare like a disease, and then they're trying to form a One Health squad to attend that epidemic. So such kind of committee should be there at district level so that these problems can be addressed in a multi-stakeholder format. And of course, this interdisciplinary program, because it is not just only the research, but even our academics, you see that we are still, we are very isolated ourselves in arts college, science college, engineering, veterinary, medical. So this is not going to work. We were originally following land grant pattern where we have multidisciplinary universities. Most of the universities, even our university originated from University of Madras, where we have all engineering, medical, veterinary. But we wanted silos. We wanted to be a separate veterinary university, medical university, engineering. Now we are thinking of collaboration. So it is, we do the mistake. The nature is same, the nature is asset. We are only trying to segregate things, and this joint collaboration is very much essential, and this should also percolate at the level of policy. It is not that, like doing an academic research or some research is joined together. There should be a policy drawn by the government, and most of the government, and there are many organizations like WHO, WOAH, FAO, everybody is trying. But the problem is the attitude. The attitude of the researchers, academics, and the administrators and bureaucrats should change. That it is One Health is very important component for the well-being of the entire planet. So that kind of attitude should change. And see, there are several bottlenecks. This is the bottlenecks, like the surveillance data. See, this we could see in our own meeting, that when we organized a meeting for AMR, there are about 6-7 departments having data on AMR for a given city. But there is no single agency which can combine everything and come up with a conclusion. So this kind of lacuna is very common, and it's an impediment to all this. And then of course policy. This policy is very critical, and especially education. There is no cross-training programs. I think now the University Grants Commission is coming in a big way that people studying in the BSc physics can go for MSc chemistry, something like that. So people now should start realizing that the importance of interdisciplinary, and this is very much more good for the One Health. And this is again most of the data, especially on diseases in India, especially for zoonotic diseases, it's fragmented. It is not no systematic study has been done. So we need more systematic studies which can probably help us to arrive at some tangible conclusion. And definitely veterinary research is not just complementary, it is essential for public health as well as One Health, and naturally to ensure global security. So so this veterinary research also by itself and also part of the One Health as well as public health. In fact, now my role as a public health team, that I am trying to connect many of the dots which is there in the field. So this is very critical, and this kind of integrated programs are very much essential. And of course, Government of India and other agencies are now augmenting this kind of program. The only thing is we should change our attitude